All right, let's talk about something really, really important. In patient care, things can happen in a flash, right? And what you do in that split second, well, it can change everything. So today, we're going to cut right to it. 4 critical, absolutely essential emergency steps every PCA has to know by heart. You ready? Let's dive in. Okay, let's put you right in the moment. You're with your patient, everything's fine, and then it's not. They fall. It happens so fast. Your heart pounds, your training is swirling in your head, and your first instinct, that gut reaction, is to help them up, right? But wait, there is one thing, one crucial thing you must not do. What do you think it is? And that question leads us straight into our first protocol. Because honestly, what you do, or maybe what you don't do in those first few seconds after a fall, that is probably the most critical decision you're going to make in that whole situation. So here it is, the answer. The number 1 golden rule you have to remember: do not move the patient. I know. It feels so counterintuitive. It goes against everything in you that wants to help. But trust me, this is the single most important thing you can do to keep them safe. Okay, so why? Why is this rule so important? Well, let's think about it. That adrenaline rush we just talked about, it's telling you to do something now. But here's the thing, you can't see everything. A fall could easily cause a serious, hidden injury, like a broken hip. And if you try to move them even just a little bit, you could take a stable fracture and make it so much worse. Your job in that moment is to prevent more harm, not accidentally cause it. All right, so you've got the patient stable. You're not moving them. What's next? Well, now you're looking for any obvious injuries. Cuts, scrapes, that kind of thing. And the rule here is super simple. It's all about keeping it simple and safe. So take a look at this. The do column, so easy. Clean it with just plain old soap and water and put a simple bandage on it. That's it. But look over at the don't column. This is where you really have to be disciplined. You might be tempted to grab peroxide or alcohol, right? Don't. Those can actually hurt the tissue and make healing take longer. And creams or ointments? Nope, not unless you're told to. They can cause a bad reaction, or even worse, they could hide the beginnings of an infection that a doctor or nurse needs to be able to see clearly. So yeah, just keep it simple. Now, there is one huge exception to that no creams rule, and it's a big one. You always follow a specific doctor's order. If a doctor has prescribed a certain ointment for that patient, then you use it. That professional medical direction always comes first. Period. Okay, so the scene is safe. The patient is stable. You've handled any little cuts. What's the next move? This next step, this is your professional lifeline. It is the most important call you're going to make. You pick up the phone and you call your RN supervisor, and I mean immediately. Not after you've written some notes, not after you've taken a deep breath, right then and there. It doesn't matter if it seems like a tiny little incident. Every single accident or injury, big or small, needs that call. It's not optional. They're your guide. They'll tell you exactly what to do next. But of course, let's be real. If it's a true, honest-to-goodness medical emergency, if the patient isn't responsive, if there's heavy bleeding, if they're clearly in a lot of distress, your first call is 911. You have to trust your gut, your professional judgment. When in doubt, call for help. Your RN supervisor will absolutely back you up on that, but your immediate assessment of a life-threatening situation is what matters most. So let's just lock this in. Let's do a quick recap. This is your 4-step emergency checklist. Ready? Number 1, don't move the patient after a fall. Number 2, clean wounds with soap and water only. Number 3, no ointments unless a doctor ordered it. And number 4, call your RN supervisor immediately. See? Simple, clear, and it could literally save a life. And that brings us to one last question, and it's a really practical one. I want you to actually do this. Go ahead, pull out your phone right now. Do you have your RN supervisor's number saved in there? Even better, is it saved as a favorite? Because when an emergency happens and your adrenaline is pumping, the last thing you want to be doing is fumbling around trying to find a number. Seconds matter. So go on, do it now. Be prepared. It honestly could make all the difference in the world.